A warm welcome to all our viewers to our series Natural Medicine. Today we are going to talk about magnesium. We all know that you should take magnesium if you have any cramps. But since I recently had a conversation with Professor Dr. Carl Hecht, I heard and realized that magnesium is responsible for much more than just preventing calf cramps. Today I would like to analyze this topic again very carefully, because it is so valuable, and I invited our visit doctor to talk about this topic. Stay tuned, we'll get started right away. Here we are again, and now I can show you my guest. There she is, Dr. Petra Wiechel, welcome. And thank you for tackling this magnesium issue with me.
That's more important than ever. Thank you for discussing it today.
My pleasure.
Because everyday life shows you how much people actually are lacking.
Yes, I just got my values today, and there is an acute lack of magnesium again. How do I get magnesium into my body anyway?
Well, how do I get it is one thing, the other is why can't I get it anymore?
Yes, exactly.
The soils are actually quite rich in magnesium, which simply has something to do with evolution. The rock releases it, but through the fertilization and of course through so many artificial fertilizers, nitrate fertilizers, calcium, phosphates, it extracts an incredible amount of magnesium from the soil. And potassium is like potassium makes it easy. Potassium can be easily absorbed in the plant, but then it blocks the absorption of magnesium. And we can hardly cover this need, we are impoverished with these things.
Well, it used to be fine, the soil was full back then, and today it is empty. Although I actually only eat organic and eat Demeter, I get practically no magnesium even with these foods, otherwise I wouldn't have this deficiency.
One thing is that I can't get enough of it anymore, but the other is that my need has also become far greater.
Oh, also.
Because magnesium has to be in stock for up to 24% as a percentage of the total amount of vital substances I need to consume. And 99% of the magnesium is distributed intracellularly. That means there is hardly any metabolic pathway, there is hardly any mitochondrial energy pathway, there is hardly any neuromuscular transmission at various levels, there is little possibility of intracellular protein synthesis transcription without magnesium. So magnesium is the absolute all-rounder of one's own metabolic process, and so central that any deficit, wherever the body decides on its own, where does it manifest magnesium? And then, of course, certain other things stay behind, that's logical.
Professor Hecht once again told me in one sentence that, according to his research, there isn't a single disease unrelated to chronic magnesium deficiency, and that medicine doesn't actually control that at all, because magnesium is classified as a food and not as a medicine and not as a food supplement, but it is a food and therefore it is not looked at all.
Well, what does that mean? It's not looked at, that's the way it is. All of orthomolecular medicine today is by no means a component of every doctor, which has to be integrated into a concept that has to be monitored. Just like vitamin D needs to be monitored, homocysteine must be monitored, arteriosclerosis factor. And that is far from arrived, and we are always quick to classify something as a disease, but we don't ask afterwards why. So when you panic, when you're restless, when your heart is racing, when you can't sleep, when your whole autonomic nervous system is completely overdriven, when you develop panic attacks, when you develop anxiety, also your mental strength, your mental calm, it's all dependent on magnesium. So, the synaptic activity, the action potential of a nerve cell, how fast is excitation transmitted? How strongly does the membrane potential build up? The membrane potential, the redox potential, is responsible for the cell being able to communicate, that's the brain of the cell. And when all these processes can no longer take place, when mitochondria no longer get the raw materials as part of their energy output because they can't dock at all and so on, then it affects all processes. That means a deficit, as we naturally perceive it today with the calf cramps, that's just a hassle. So if that's noticeable, then all the bells have to ring. And this spasmophilia, which many people also have, spasmophilia now in the sense of when muscles cramp, but it's not just about striated muscles. Imagine if you had this cramp in your heart, that would be unbelievable, but now you have cramps in your calves and wake up at night. But if you have it on the bile ducts or in the intestinal musculature, namely smooth musculature, then we call it irritable bowel syndrome.
Oh.
Or if you have it in the bile ducts, then you have biliary colic, or you have spasms, or you have indigestion and you suffer from bloating, or you are exhausted, you are tired because your vessels are tensing up and of course the cell does not get enough oxygen. So magnesium is involved, really down to the last corner. That means you can't really take enough care of these things, that your body is well taken care of. And this central atom of magnesium within the cell metabolism or association metabolism at plant level, like iron hemoglobin, is very central in photosynthesis. This accounts for only 1% of the plant. So green, dark leafy vegetables, as people used to think, are rich in magnesium, they're not. Then there is cocoa and millet and also almonds, such things are much, much richer in magnesium. Well, nowadays it's really easy, you can just Google it and say, where do I have a high quality in nutrition, where do I have to pay more attention, and when this is also ecologically or biologically certified, then you can really go for it. But one must not forget that the liver hoses an incredible amount of magnesium, that the nervous system hoses an incredible amount of magnesium.
Well, the more we poison ourselves on the one hand, and on the other hand, we have more and more computer activities, sitting activities.
Of course, you need more excitation transfer, you need more dynamics, you need more concentration, that's all magnesium, otherwise all these neurotransmitters can. And the whole action always has to be built up all the time, so of course a lot of raw materials are needed.
Also, the many fatigues from society, always tired, exhausted, could ultimately just be a magnesium deficiency.
Yes, also the formation of oxalate stones in the kidneys, because calcium and magnesium are opponents. And if magnesium is missing and more calcium is needed, then it is logical that the bones also become impoverished there. So when it comes to healthy bone health, no one thinks the first thing is magnesium. Just don't add inorganic calcium, the body has enough, it has to provide it from the bones, it breaks down faster than it builds up in these processes.
It's written here too, breaks down bones.
Yes, and all the tendons, all the joints, all the collagen. Osteoarthritis is treated with magnesium, which is very important.
Really?
Yes, of course, because these things don't regenerate themselves otherwise. Magnesium has an influence on regeneration, on the entire protein synthesis. Magnesium is so involved in all of these processes that then the body simply goes empty. And when I'm under stress now, for example, I have a big need, so people are in some stressful situations, if they persist, under a tremendous restlessness, fear, can't sleep, sometimes they have to cover their eyes all the time, because the light is too strong, because the lens, the eyes, are controlled by muscles, and when the smooth muscles no longer have enough magnesium or striated, then I can no longer adapt the eye to light and brightness and to the environment.
But these are all symptoms that you are describing, and the viewer really has to listen very carefully. So if they react sensitively to light, their nerves are constantly on edge, they sleep badly.
If it vibrates like that, the eyelid muscles, I know it myself, there were phases in my life it really started, then I realized the eyelid is constantly trembling, that's magnesium, you can fix that very quickly, that's a typical sign. Or even if you have tics, if your muscles vibrate or you have things you can't control, it's a magnesium deficiency.
I've done 3,000 interviews now, and today we're actually getting to basic medicine. That affects almost every viewer, and we've never talked about it. Really embarrassing and bad, I think. I have now taken 7 measurements with 7 GLAGs and found that all of them have a huge magnesium deficiency.
You also have to measure it intracellularly, that's very important. So in the plasma, in the liquid of the blood, magnesium is 1 to 2%, that's not a statement at all. You really have to have it measured intracellularly, they say in whole blood, then the lab knows. And then you see what's left of the cell. Because what always touches me so deeply is, people get diuretics for their blood pressure stuff, water tablets. It's a bad habit to prescribe water tablets and not to fill up, because they not only excrete water, they excrete valuable minerals. And if the communication between sodium-potassium pump, between magnesium-calcium, between intracellular-extracellular no longer works, if magnesium can no longer dock to the heart receptor because there is not enough, then the heart goes into an arrhythmia. With the arrhythmia, why not start with the most mundane things first? I hardly ever have a patient who comes from a cardiologist and has their mineralization corrected. The heart is highly sensitive, quite apart from the fact that toxic things are of course also attached to the heart receptor. Mercury blocks the magnesium receptor or the potassium receptor. But this is so fundamentally important that I always recommend my patients to get magnesium in the evening, when they go to bed, because they relax the vegetative system better in the evening, and because of course that gives the body a bit of what it just had to juggle during the day. Of course on a stressful day it is incredibly exhausted and the next day it's the same again. And symptoms are there to understand them and to take them as an opportunity to provide the basis first. Every patient who has a headache is first given a high dose of magnesium. The spasm causes an undersupply of oxygen in the capillary area and pain receptors are then awakened. That's logical, the headache, the migraine. And how nice, the nurses know all by themselves what to do if they have a headache, plus a high dose of Q10. So sometimes it's not necessary to take painkillers. Maybe the headache is just a result of saying, well, if I'm honest, I drank too little and neglected myself somehow. And what viewers should also know, no matter what they supplement, they have to take care of the needs of the body first, at the mineral level, and then take the next step. Anything else doesn't make sense because all the B and C and D and A vitamins, everything cannot work without magnesium. And this is a king mineral.
But nobody talks about it.
Well, for some it may be self-evident and others smile at it, unless people would clarify these things for themselves from experience. From many things. Medically, it's far from being established to worry about that too.
But again, all chronic illnesses and serious illnesses are also related to magnesium deficiency. So you should at least ask all the viewers affected to look at their magnesium values. Do you have to look at it, or can you swallow it straight away?
Well, the body is incredibly grateful if you swallow it right away or that you pay a greater importance to foods rich in magnesium. But there it comes again, what we said at the beginning, it has to be very balanced and also rich in content. This is not so self-evident that we say today that I can clarify everything via nutrition. I can't do that anymore. Just like selenium. We have already made shows about selenium, as the most important trace element really for detoxification, for the thyroid gland. These are things that people need to know today. It makes a lot of sense to substitute. And above all, if you are already under a certain burden in life, then you must also take care of it. Then you can swallow it right away.
Swallow it right away. I bought a can like this, it said magnesium chloride on it. I thought that was the right thing. It was completely wrong. It was so salty I can't get it down.
You can bathe with it.
Yes, I then threw it in the bathtub. What can viewers do?
There are different forms of magnesium. There's magnesium orotate, magnesium glycinate, magnesium citrate. And what citrate does when you dose it too high, which is very nicely absorbed intracellularly, but then there is actually a soft stool because it relaxes the smooth muscles of the intestine. But we work a lot with magnesium citrate. If I have heart problems, I like to work with orotate. And otherwise I use the magnesium glycinate because it allows me to dose higher. That doesn't cause diarrhea. And this thing is actually pretty good to deal with.
Can you get it at the pharmacy?
You can get that in the pharmacy. I would like it, not with so much dye, which is all a bit colourful. But sometimes it's good to be able to drink it too. The citrate is a diasporal. But there are different things. You can then look at that.
You mentioned 3 great things to me now, but I think you have mostly recommended glycinate.
Yes.
Do you want me to say that officially, to the viewers?
Yes, but also citrate. A nice magnesium citrate is also good. You just have to look. In some situations I usually always say 300 to 600 milligrams. And then, for example, with very severe back pain. Back pain is tense muscles. And if you relax the muscles, then your pressure naturally decreases. But if you then take 900 milligrams, it can be that your intestines work pretty quickly. And you can slow that down very well with magnesium glycinate. So patients going through high-dose vitamin D therapy, MS patients, or something, we work a lot with glycinate, because then I can dose it pretty high, because of course it's onto the neuromuscular transmission, the nerve transmission, on the signaling, on the cellular action potential. And we work a lot with glycinate. And then I give 2 times 2, even up to 2 times 3.
Now I think we have to list a bit of possible symptoms again. You just mentioned back pain. And I'm seeing it in me right now. Since I've been exercising, I've suddenly had back pain, increased stress everywhere. And now I have proof of the magnesium deficiency. Now you say, it's logical, the connection is clear. You mentioned the eyes that suddenly vibrate a bit. We have addressed the chronic diseases, we addressed nervous weakness and sleep problems. Do you have any more listings so the viewer can reflectively discern, this is my symptom, oh, that's also a magnesium deficiency?
Angina pectoris. Spasm, anxiety, cardiac pressure. Always think of magnesium first, because if there is a lack of magnesium and I still have a problem, which of course takes my breath away somehow or I have to endure a lot of heartache, then the musculature of the coronaries tenses, then the heart gets too little oxygen and then I get heart pressure, also thoracic pressure. It's not always something that ends in a heart attack, but of course it causes heart pain. Blood pressure is a magnesium problem.
Blood pressure?
Well, of course, if the musculature, the vascular musculature, the capillaries, the arteries, the veins, when they have to be tense because magnesium isn't there, the pressure increases. And you can lower the pressure with magnesium alone. We give magnesium chloride in the form of infusions. That is, if I inject magnesium chloride for example. It's like, well, I never smoked a joint in my life, but people say, please more, please more. There is such calm, such warmth, everything opens up, blood flows through it, and you can do that very quickly to allow the calm to return, to raise the parasympathetic nervous system, to lower the sympathetic nervous system, and blood pressure is a very big issue. So no patient with blood pressure can go through life without magnesium.
But does the patient know that? They're on some blood pressure medication.
From today at the latest through you.
Yes, thank God. Do you know how important it is what you said to me today?
It's very important, very important.
I wasn't aware of it.
That is very important. And, as I said, spasmophilia is said to be everywhere where there are convulsive conditions. And everything in our body is held by strength, by muscles, by tendons, by ligaments. And muscles are tense. If this exchange between magnesium, then suddenly there is an excess of calcium and the muscles become really hard and tight. This means that magnesium always creates a balance.
Now we come to this sodium-potassium pump. Professor Hecht once told me that the many athletes who have recently dropped dead actually have a magnesium deficiency, and it's not just somehow due to a corona vaccination, but it would have to do with that. They would have investigated it well long ago. And this stress, which we are having more and more, also in connection with corona, means that we are even more deficient in magnesium.
And then you mustn't forget when the excitation transmission no longer works. And the heart is dependent on the impulse. It comes to the heart via the AV node. And if the transmission of excitation is in danger and the need is enormous, because you are under performance requirement, then maybe it's somehow that the body says, it doesn't work. And there it is, life-threatening. Without question.
I'm a bit shocked. Let's ask one more hypothetical question. If you examine 100 patients for magnesium, does anyone have normal readings?
Yes, some have. And then there are people who are perhaps not stuck in the stress of life. It's always a matter of need and necessity. It's the people who supplement. I question that, of course, when I see normal values there. But intracellularly, and this is the key, to know how much selenium, how much magnesium, how much zinc, and how much potassium. I have to measure these four things intracellularly. I have developed a so-called intracellular block for this. That's the basis for everyone. Because without potassium we are in great danger. Without magnesium it is inevitable that the things it already tells me in connection with that. And then it becomes very easy to bring things back into balance. And then we'll take a look and try not to approach from above.
That's nice the way you say it. It really is this micronutrient therapy. When the biochemistry works, the body can find its inner doctor and assemble everything it needs.
And it's smarter than us. Much smarter, because it tears exactly and also recognizes the necessity. Now more hormones must be formed. So magnesium alone is important for the entire protein synthesis. The DNA uncoils to be read as messenger RNA. That is the protein synthesis in the cell nucleus. That controls all the magnesium.
Could this arginine deficiency eventually be associated with magnesium deficiency, if you mention the protein?
Exactly. Doesn't even come into play. Doesn't even come into play. An L-arginine deficiency is important for blood pressure. I give L-arginine for blood pressure. It has something to do with all the nitro stress. And to understand things. Today, doctors really need to be trained in orthomolecular biology in order to first understand that life in its intactness is always tied to assumptions. And that was certainly, definitely not a question in the past for people. No question at all. Because of course they had a very different lifestyle. But we must not forget that alone in 100 years things have now increased many times over, which we today, in dealing with life, of course, have to assume a completely different basic supply. And we apply the same standard to everyone. And that doesn't work either, because my needs are higher here today and my body can cope wonderfully with less or the optimal one. And it reserves the right what it sees as a priority. And we have no influence on that. We can only take care, responsible, that we do these things. It doesn't get straight to the symptom. There is always a symptom if it can't make up for it now. Otherwise it steals here and there and always tries to do the best somehow every day. But if it activates a symptom, then it doesn't help to take buscopan, for example. This has an antispasmodic effect on colic. But then first of all a lot of magnesium, that the musculature can please relax again and the whole system can act again.
You just mentioned the word that it steals it, wherever it is. You are right. I mean, the values show that we steal the magnesium from the bones. Eventually, the depot will be exhausted.
But who talks about magnesium when it comes to osteoporosis?
No, nobody. It said it's potassium.
Calcium. And then inorganic. Because magnesium also connects.
Drink milk for strong bones. Well, let's leave that. We started with magnesium, but now you suddenly named another 4-pack: selenium, magnesium, zinc and potassium.
Exactly.
These 4 are the basic building blocks, important building blocks. Would you now recommend to a person with a chronic illness to have this examined intracellularly by a doctor?
Always.
And insisting on it?
Always.
Good.
Always. In whole blood, that is very important.
Intracellular in whole blood.
Exactly. And that you also know that some things cannot be stored by the body. For example, it cannot store zinc. And if it doesn't have enough zinc and the opponent is selenium, and so each has its opponent too. Zinc is an opponent of copper. If these things aren't there intracellularly, then a development is inevitable.
And the people who are healthy but are watching the show today because they know it's an important and meaningful show, they should actually measure these 4 things? Or can you just blindly swallow all 4?
No, I wouldn't do that. Anyway, I don't think it's good that you swallow something blindly. So you should do it with caution. And it's not like I'm saying you always have to know the lab value. But if I want to check myself again and again in this regard, I should do that. And I should do it, too, if I at least sense that something is wrong. I was diagnosed with osteomalacia, which is the preliminary stage of osteoporosis. The bone structure would not be solid. It can be a sulfur problem, it can be a zinc problem, it can be a magnesium problem. Therefore, everything is involved in this bone metabolism. This has nothing to do with me needing to know how is my vitamin D and calcium.
I understand. But a lot of the problems we're going to touch on today have also been solved. And on the other hand, it's just being tried somehow in physiotherapy or in this or that to stabilize on an effective level. But the cause is not resolved at all. And we really learned a lot today. My last question: when I get this magnesium glycinate, are there quality problems, differences, or can I do nothing wrong if the viewers now go to the pharmacy?
That overwhelms me to answer, because actually, I work in my area with certain products and then I feel very comfortable and very safe. And I can't decide now.
Which products?
I work with Heidelberger.
Heidelberger, is that a company?
Exactly, Heidelberger Chlorella is a company and they have a very nice magnesium glycinate. But I want to break free from thinking it's the only thing. There are certainly very good and many providers who also produce magnesium glycinate.
Great! Wow, Petra, I'm so happy.
Me too. Thanks very much.
I didn't think that I would have to do so many shows to finally learn something about magnesium.
There is a lot to learn, and we can also talk about a lot of nice things from time to time, because they make people more thoughtful. And the fact is that nowadays we should also resort to balancing one or the other. Otherwise, of course, it would be even nicer if we managed it all from the point of view of nutrition. But of course worlds collide: what people do today for themselves as part of health or with themselves, and how life demands them and what life demands of them. We've got to strike a balance there. Right?
Absolutely. Thank you very much.
Thanks too.
That was for you, Dr. Petra Wiechel from the Swiss Mountain Clinic, dear viewers. I'll spare you a little synopsis of mine now. I think we gave a lot of hints about what kind of symptoms a body can give, to signal that it is magnesium deficient. And please watch the program a second or a third time, and also distribute this program to people who may have exactly one of these symptoms from their point of view. I don't know what's more important than watching this show now and thinking about whether we are magnesium deficient or not. Because the time we are in today clearly shows that the need is ever increasing, but the supply of magnesium is getting smaller. With that in mind, thank you for watching, and see you next time.